welcome to this edition of Keeping Lowell Connected. Today we have Susan Levine, CEO of the Lowell Community Health Center, and with her is nurse practitioner Diane Mahoney. Thank you so much for joining us.
Thank you for having us.
Yeah, thank you for having us.
Let's just start off right away because I know there have been some big changes at the health center because of the pandemic. How have you adapted your services to the community?
Yes, so there's been some pretty dramatic changes. We, as you can imagine, our very first priority is the health and safety of our patients and our staff. So around March 12th, when we realized that we didn't have sufficient PPE on site and the supply chain was in jeopardy, we knew that we would not be able to maintain full service operations at the health center. And so we made a very bold decision and we moved 97% of our services off-site by Monday, March 16th. And the health center today, there's very few people on site and they're only seeing a certain category of patients, and all of that is to protect the health and well-being of our patients. So it was a very, as I said, it was a very bold move. Most of our providers and staff are working from home.
How many providers do you have at the health center?
So we have about 70 physicians and nurse practitioners, almost 50-50, so 35 physicians, 35 nurse practitioners. And we have about another 30 behavioral health clinicians. And so all of those providers and our nursing staff, our medical assistants, and our other enabling services, they're all working remotely, except for that small footprint that we are maintaining at the health center. And what we're doing at the health center right now is we're taking care of urgent cases that need to come in to see a provider on site. And then high-risk patients such as high-risk newborns or pregnant moms or individuals who need, for instance, weekly injections. But the footprint at the health center, there's probably 20 people per day at the health center.
So what do people do if they had a physical planned or they wanted to come in for some routine procedure?
Yeah, so much like the rest of the healthcare system, routine procedures or routine appointments have moved to a model called Telehealth, and which I know Diana can describe a little bit more about how our telehealth model is working. But for the most part, we are doing all routine visits via telehealth, which could be by telephone or also by video.
Diana, do you want to explain how that's done?
Yeah, so a patient that may have already had an appointment scheduled, such as for physical or routine follow-up of high blood pressure, diabetes, those visits are now being moved to telehealth visits. So they're by phone. So basically the patient is notified that instead of being seen in person, that I'll call them, and then I call them at a designated time, and we talk by phone. A lot of what we do in primary care is easily transferable to telehealth, because a lot of what we do is talking to patients, counseling, preventive sort of thing. So it's actually pretty seamlessly transferred to this setting.
Is that video or just telephone?
Video and telephone. So I'm doing mostly telephone, but we do have video capability as well, which is wonderful.
How did the doctors like this switch?
I found that everybody has liked it. It's definitely been something to adapt to. So I felt like I'm missing kind of a whole tool that I normally have, which is seeing the patient, examining the patient. But a lot of what we do and a lot of our clinical reasoning is accomplished through talking to the patient. And so it's actually pretty transferable in that way.
Well, I understand that it's new that providers can get reimbursed for telehealth visits. Do you think that this will continue after the pandemic? Is this another way that we're going to be seeing a complete change in the healthcare industry?
Yeah, I definitely think we're going to see this change, this new telehealth approach. It's not even new. Telehealth has been around for a while. For community health centers, we were waiting for some of the reimbursement systems to catch up so that we could deploy telehealth. So we actually weren't really ready to deploy telehealth before this crisis. And before I finish the rest of your question, I do want to say I am just incredibly impressed with our ITIS teams. As again, we made the decision at the end of the week of March 13th to suspend operations within the health center. And by that following Tuesday, we were fully operational with regard to telehealth. And that was just a Herculean task. And I'm just amazed at what our team was able to accomplish. And so I think telehealth it's going to just be part of our model going forward into the future. I think we'll have a hybrid of on-site visits, and we'll definitely continue with telehealth. I think it's premature for us to understand what that might look like, weeks and months down the road. But I'm getting across the healthcare industry with my health center colleagues in other health centers, really getting positive reviews from patients about the ease of access to their care teams through telehealth. And one of the things that is sort of core to the foundation of a community health center is about knocking down barriers to care. And so if you think about all of the barriers that one might have to encounter just to make it into their doctor's office, whether it be parking, whether it even be having a car or childcare. So the fact that we can care for people in their own home and somewhere down the road with some enhanced technology like in-home monitoring for blood pressure or what have you, I definitely see this as where we will be headed in the future. And it's going to improve access to care, and it will really help us tremendously in our mission to take good care of our community, because it's going to give us more tools in our toolbox to do that.
That's really amazing that things have changed so quickly and you were able to pull that off. I know that people might be thinking, well, when I go to the doctor, he takes my blood pressure, or she takes my blood pressure, she takes my temperature, she gives me vaccines. How will that all be handled, or will there just be a real mix of kinds of visits?
So, so a lot of people have home blood pressure cuffs that they're checking their blood pressure at home already. They've already had this. So I think it's actually a good model for empowering patients as well, because they're taking more charge of their care. It's more of they're taking more active role in their care and checking their blood sugar, their blood pressure. A lot of them will check their blood sugar at the time I'm talking to them on the phone, or check their blood pressure at that time. So we can do a lot, even though we can't check vital signs, the full set of vital signs. And you can certainly count a respiratory rate, looking at a person on a computer, look at how much distress they're in on a computer. So there's a lot you can do, even though they're not physically there.
And would you say that even elderly patients are feeling good about this?
Yes, I am. I'm finding, elderly patients sometimes can have a hard time getting out of their house. They have to get a ride to get into the office. So there's a lot of barriers to care in that population that this is breaking down the ability to take care of them on the phone. And especially in the midst of this epidemic, to be bringing our most vulnerable population in, are people with a lot of chronic medical conditions that have to come to the doctor a lot anyway. To be breaking down barriers with that is very important for the community.
How about language services?
So yes, so we have access to our in-person interpreters through an online scheduling system. So we can request our in-house interpreters who are also working from home, and then we just do a 3-way call. And then we also have access to another interpreting services that if our in-person, if it's a language that's not offered by our in-person interpreters, we're able to access a lot of languages on that service through a three-way call to the patient.
That sounds amazing. And how about mental health services?
Well, I'll start there. This is one of, there's so many bright spots in terms of our health center's response to this crisis, but the healthcare system in general. I'm just so proud of all of our healthcare colleagues and how they are responding in this crisis and making sure to take care of all of our patients. But one bright spot really is in the area of mental health and behavioral health services. We are seeing that we're able to provide an additional 25% access to patients for behavioral health and mental health services. So our behavioral health clinicians and our psychiatrists, they're doing their visits by telehealth. And this is all anecdotal. We'll have lots of time to analyze this and sort of perfect our model going forward. But again, if you're facing barriers to care, whether it's just getting to an appointment, to be able to be in the comfort of your own home or your own setting, and to be in some of our providers describe it as a very personal phone call. It's actually demonstrated a more satisfactory call for both patients and their behavioral health clinician. Within our behavioral health service, we traditionally have had a very high no-show rate. So you can imagine, again, with all the barriers to access that people face, or let alone when, with behavioral health, and I know this in my own family, when you want to connect with a provider, you want to connect with a provider when you need to connect with a provider, not on the provider's schedule. And that's what telehealth has really opened up our world for, is that we're stripping away those barriers and making our providers who want to be very accessible to their patients. And so they're able to see more patients. As I said, we've seen a 25% increase, and we have a behavioral health epidemic in our country. So the fact that now we can tackle that and improve access and serve more people, that's just a really wonderful bright spot.
Well, I just have a question about privacy during this pandemic and doing telehealth for mental health services. I know it's sometimes difficult to even get a quiet space in your apartment. So are you having problems dealing with that?
Then maybe I'll start. From a staff perspective, we do have guidelines for how our care teams should take care of their patients through telehealth or through video conferencing. And some of the software that we use is HIPAA, the software that we use is HIPAA compliant, and that protects the privacy of the patients.
Great. And are your doctors seeing a lot of COVID, and how is that going with telehealth?
It's really been interesting, and I'll let Diana chime in as a provider, and I am not, but from a numbers perspective, we are definitely seeing an increase in the number of phone calls coming into the health center, and then therefore resulting in appointments with their providers. So the last week, we've definitely seen an uptick, and so all I can say is anecdotally, that would appear to track with the surge that's occurring now in Lowell, and I want to be careful using that word, but we just know that we have more positive cases. Our hospital is managing them beautifully. They're not at capacity, so I don't want to use a loaded word like surge in a way that creates any concern. Our community, our healthcare partners across Lowell have done a wonderful job preparing, and we had a little gift of time in Lowell as other communities have not. And so I think we're starting to see the increase in cases, but our healthcare system can manage it. But definitely we are seeing more calls, and it can be related to people who are concerned about being exposed. They may have tested positive, or just, we've been in this now for a month, and we're definitely seeing more fear and anxiety and stress related to living in isolation and not knowing what the future holds. We're definitely seeing more on the behavioral health side as well.
And has it been difficult to, well, keep people out of the hospitals if they do have respiratory symptoms that seem to be COVID? Are people doing pretty well at home, or?
Yes, I'm seeing people do well at home, managing at home. So I'm following, it's a lot of the visits I do now because I'm following people very closely with it. Usually every couple of days I'm calling and checking in. Yes, I'm managing a lot of people without ever having seen them in person, which is good for the community, protecting our providers, our staff, and also keeping patients safe too, the best we can. So I'm doing a lot of phone visits for COVID.
Yeah, and if I could
symptoms, need testing. Yeah.
Right.
That's it. Yeah.
And I'll just add to that, our job in this COVID crisis is to keep the right people who are symptomatic in their homes, so that we are not inadvertently sending more people to the emergency department and causing more pressure on the hospital system. And at the health center, we stood up an incident command system to manage this crisis. And our incident commander is our Chief of Clinical Services, Beth Hale. And Beth sits on the incident command at Lowell General Hospital. So we are highly coordinating our daily response efforts to sort of manage and make sure that people are in the right care setting so that we are not overloading the healthcare system. And that's proven very effective in our community.
And people's primary care provider are well situated to take care of them while they have this illness, because I already know them. So it's a lot more familiar to them to be taken care of by somebody who's already been taking care of them for all their medical needs before all of this. Now they have COVID and it's the same person that they know, even though I'm not seeing them in person for it. I'm a familiar voice on the phone. So I think that's actually the ideal person to be taking care of them, if they as long as they don't need the hospital, of course.
Yeah. Well, I know this is the $20,000 question, but we're in a surge right now, which is the third week of, are we in the third or the fourth week of April right now? Well, I guess it's the fourth week of April. Do you know when this is going to start leveling off and decreasing? Do you have a sense?
So I definitely don't. I watch the news and I follow the governor's press conferences and the daily statistics. So no, I certainly couldn't answer that. We are starting to see some indicators statewide that we might be coming slightly down on the other side of the curve, but it does depend on what community in which you reside. And you have to be careful that it could uptick again. And so we just monitor the data daily, and we make sure that we are ready to respond accordingly.
And will you open when the governor says that it's safe to open businesses, or you're going to, do you have your own metrics?
Well, our number one metric is personal protective equipment. And so as you can see, I'm zooming in with you from home, excuse me.
Uh-oh.
I swallowed wrong. And there's no other place I'd rather be than at the health center. But if I were to be there, I would need to be in a face mask at a minimum. So I'd need to be in PPE. We just do not have an adequate supply to return either our care teams or administrative staff, such as myself, to the building. Once that supply chain gets corrected a bit and we have an ample supply, then we will start to bring certain services back on site. An example of that is we have children who need their immunizations, and for the first few weeks you can delay when they get their immunization, but you can't wait too much longer. And we certainly don't want to create another event or exposure with another virus. But so we do need to get our children in for their immunization. So we're talking now about what would that take to create, for instance, just an immunization clinic. and how much PPE would we need to do just that. So I anticipate, though I don't know for sure, that we will slowly bring critical services back on site as we have the appropriate PPE, and then hopefully someday we can bring the full sort of contingent of staff will return on site. But it's pretty early to make that call.
Well, how would patients get in touch if they have an issue that they want to call, even to set up a telehealth visit?
Yep. So they call our main phone line, and that is the best way to get into. We have a fully staffed call center, and on Facebook I do something called We Love Our Staff Wednesdays, and our call center staff are the ones that are featured for today. They are working on site at the health center, taking all of these calls and connecting our patients with their care teams.
What is that number?
978-937-9700.
Great. And that's the number that people can just start getting into the system and have their needs met.
Mm-hmm.
Yes, and one other note, I would recommend that people, some people have their caller ID blocked a number that it's an unknown number, and often it's your provider trying to reach you if it's a scheduled time for your visit. Just a note, if any viewers are patients of the health center, to unblock their phones.
That's great advice.
Okay. Is there anything else people should know about the health center right now?
We are here. We may not all be in the building, but every single one of our health center care teams, and staff, they are working diligently, from whether it's a home office or some who are actually on site. We are here. We might be here virtually. That phone number is very important. And patients should know that they can access their provider during this time, that we are there for them.
Okay, great. Well, thank you so much for coming in and talking to us and getting this information out. I'm sure people will want to know how to get services. You serve such a large proportion of the people in the city. Your services are really vital. So thank you very much.
Well, thank you.
Yeah.
Thank you very much for having us. We do serve about half the population of Lowell, so we do appreciate you getting this message out to make sure that all of our community members know that we are there for them. So thank you.
And thanks so much for joining us at home.